Welcome once again to Breakfast Central on a Thursday morning, first day in the month of June. Now, South Africa continues to face a critical shortage of nurses and healthcare professionals in healthcare facilities. The largest private healthcare network has warned that the shortage of nurses threatens healthcare provision in both the public and private sectors. The country has an estimated shortage of between 26,000 and 62,000 nurses, as well as a large proportion of health workers due to retire by 2030.
Many doctors are also leaving the country for greener pastures in Europe. The South African Medical Association also lamented concerns over healthcare professionals being overworked, affecting the quality and accessibility of healthcare services across the nation. Joining us now to discuss this further is South African Medical Association Chairperson, Dr. Mvuyisi Nzukwa. Thank you so much for joining us. Good morning, Doctor.
Good morning to you and good morning to your viewers. Thanks for having me.
All right. Doctor, talk to us about how severe the scarcity of healthcare professionals is in South Africa. We've seen in other parts of the continent where there's been some form of mass migration from one part of the country, from their country to another part of the continent, oftentimes the West. Is that the situation in South Africa?
The shortage of healthcare workers is a global phenomenon. It has been noted by the World Health Organization that at least by around 2030, there'll be about 10 million shortages of healthcare workers across the globe. But South Africa is not exempted from that. We've got shortages of staff, human resources for health in the country, mainly nurses and doctors. So the cause of that obviously is due to many factors. In the country, there is no budget to absorb more of these healthcare workers. And they then live at home unemployed, and they decide to go abroad and seek employment elsewhere. So that is what we are facing at the moment. But otherwise, there are many trained professionals in the country, just that they are not absorbed by the system. But also, if we don't continue to train more nurses and doctors, we are going to feel the shortage as we move towards the implementation of the national health insurance in the country.
And when you say the country cannot afford to bring in more, does that mean that the South African health budget is not enough every year? Or is there questions that need to be asked concerning how much is invested in healthcare in South Africa?
Yes, over the past 4 or 5 years, there's been a consistent decline in the budget allocated to health of about 1%. And that has caused so much strain on the health budget. And it is what is causing, according to the Treasury and the Department of Health, it is what is causing these shortages. And we know that is going to have a serious impact on the health outcomes in the country, because you can't expect to have less workers on the ground and expect them to do more. But also the impact is felt by the healthcare workers themselves, because they suffer from burnout, they work long hours, they do overtime and all these things. And this is not acceptable, because it has serious implication on their psychological well-being.
All right, now let's talk about some of the other factors that might be contributing to this shortage, or why the country is seeing so much shortage in health workers. You've mentioned a number of factors, but are there other factors we probably haven't highlighted?
There are other factors, like, for example, some of the workers would leave the state because they are frustrated due to poor working conditions, and they will go either to private sector or they'll go abroad. And some of these healthcare workers, they go to first world countries like Canada, the UK, Australia, New Zealand, and many other countries. So it is important that also the country looks at its working conditions, because we are not only losing just healthcare workers. These are skilled, high expertise healthcare workers that we are losing to other countries.
All right, now let's also talk about, what this portends for the average South African. Of course, you know, we across the continent would always look at maternal and infant mortality, look at, you know, the current cholera outbreak in South Africa and different other, you know, aspects. And so how much of a danger is it, you know, for the average South African being able to access quality health care in the next, let's say, 4 or 5 years?
Well, it is a dire impact on the population at large, because you'll understand that the population is growing whilst the number of healthcare workers is declining. But what that means is that you are going to have a backlog of surgeries where you find that a patient is booked for an elective surgery and that cannot be performed on time because there's shortages of staff. And the other thing that may happen is that you are going to have epidemics and at times, you know, those outbursts of cholera and stuff like that. And there will be not enough healthcare workers to stomach those surgeries. So that is why we are pleading with government to say, government, you cannot afford to have healthcare workers going to other countries, or you allow a shortage of healthcare workers in the country, because it will cause other unnecessary adverse events on the patients. And that will increase, by the way, even the litigation bill in the country, because South African patients, at times they can litigate when they think they're not been attended to properly in terms of their medical services. So that is very important to government, not only to save money, but to save lives and make sure that the outcomes becomes better for the country.
All right. Sometime last year, there were conversations, a lot of controversy was stirred as a result of a statement or a conversation that was recorded on camera by Limpopo Health MEC talking about how residents of foreigners should return to their country because the country, they would believe that South Africa didn't have enough resources for its citizens. And as such, Zimbabwe, for instance, which was the country in the case study, should be able to cater to its citizens. Is that still a concern? Is that maybe a likely solution? And would you say that the government has proposed any plan of action in response to this?
Well, the incident that you are referring to, first of all, it was very true that there is strain that is felt by South Africa. But I do think that we must say publicly that it was unfortunate that the MEC had to speak to a patient. You cannot do that, speak to a patient when you complain about political issues. We believe that the MEC, as one of the political people, should have addressed that with the political principles in other countries. What we have suggested is that, you know, if there are patients that are coming from other countries, especially SADC, the South African government needs to have a conversation and keep data, you know, and go to those countries and say, please contribute financially to our country, because your patients, here are the patients coming to our country seeking healthcare services. So I think that's the conversation that SADC must have, but it can't be a conversation that is made on the bedside with the patient.
All right, final question. Give us an idea what the average salary is for the South African healthcare worker.
Come again?
Can you share with us what the average salary is for the South African healthcare worker?
Well, it will be difficult to say so because you know, there are so many levels. Even within the medical profession, there are different levels of payment or salaries.
Yep.
The nurses, that's the same thing applies.
Yeah. Okay. All right. I was going to break it down even further, but never mind. Thank you very much. We understand that health is a very, very important conversation across the continent, and every now and then, each country needs to do more to ensure that the healthcare status is better improved. And like you said, the budget for healthcare in South Africa continue to dip. Maybe Cyril Ramaphosa needs to work on that and ensure that they invest more in healthcare. But thanks for your time. We will be speaking with you again pretty soon.
Thank you.
All right.